Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us yet again Dr. Darius Soonawalla. Regulars at the Health Live seminars would know that Dr. Soonawalla was with us in the late June this year, and he had spoken about various orthopedic issues, knee replacements, joint replacements, and today we have him here with us to speak about knee replacements. A little about Dr. Soonawalla. Dr. Soonawalla is a senior orthopedic and joint replacement surgeon attached to the Breach Candy, HN Reliance, Saifee and Jaslok Hospitals. His areas of interest and specialization are joint replacement and complex trauma. Welcome again, once again, Dr. Soonawalla, to Health Live at Seniors Today.
Thank you, Pradyumnan.
How's it been for the health fraternity in these years? We met you in June, where it was, I would say, still early days, and now you all are the frontline warriors. How's it? Even though you are in an orthopedic as an orthopedic surgeon, obviously people are coming to you for surgeries now. So is it back to the elective surgeries?
It's not back to 100% normal yet, but definitely now people who had opted not to have elective surgeries are now going in to have the elective surgeries. So the numbers are picking up. And the good part is, at least from the COVID point of view, I think we now know the treatment protocols, the systems are in place. So that part also seems to be under control.
But most of these surgeries require hospitalization, etc. So is it safe to be in a hospital? Because obviously hospitals also have COVID patients in there, and when you come for a checkup, you don't really know whether the other person next door is positive or not.
I think it is pretty safe to go into a hospital for the simple reason the amount of precautions we take in the hospital is far greater than one would do at home. And if you were to realize that most people who have got it essentially from home. So I think it is, I would say it's very safe.
Doctor, when you would come here in June, you had said about how knee surgeries are fairly successful, but it is important to understand when should one go for it. If the knees are handicapping you significantly, then that would be the right time for a knee surgery. And of course, you had said to consult your doctor to check if you require a knee surgery. We have a host of people here, as always, and I would request people to put in their questions in the Q&A tab. But a few opening remarks from you, Dr. Soonawalla, and then we'll get to the questions directly.
Okay. So essentially, knee replacement is done as a procedure to alleviate pain in the knees. So that's the primary reason why you do it. The reason so many knee replacements are being done is because it is an extremely successful surgery, and the recovery now is very rapid. So by and large, it's an extremely successful surgery. And if you have significant pain in your knees, then it has a very successful outcome. There are various types of knee replacements, but basically, if I were to just classify it, you can have what is known as a partial knee replacement, where only a small part of the knee is replaced, or you can have a total knee replacement, where all three compartments of the knee are replaced.
Right. Thank you, Doctor. We have questions coming in, and some of the questions are questions that came by mail. We have a question from Rajkumar Krishnamurthy, who says, I'm 73 years old. Will it be okay for me to do sit-ups without damaging the knee joints?
If you have early damage in the knees, I would advise you not to do sit-ups, but rather do some other form of exercises which can strengthen the legs. But if you don't have any damage in the knee, it's perfectly fine to do sit-ups. That's as long as you're not overly heavy. Because if you're too heavy and you do sit-ups, you can damage your knees.
Right. We have a question from Pramila Gada, who says, uh, who asks, knee operation से कैसे बचा जा सकता है?
Well, what you can do is, if you are overweight, lose weight. Avoid very high impact activities like jogging, but you must do exercises which are non-impact, like free exercises, cycling, those sort of exercises. Strengthen your knees and hopefully you'll avoid a knee replacement.
We have a question from Venkat Sundaram, who says TKR is not necessary in all cases. Partial replacement can it be effective? How much time does it require? How much time do you require to recover from TKR? And is slow jogging recommended?
Okay, so essentially the knee has 3 compartments. If only one compartment is affected, then yes, you can do a partial replacement. You certainly don't need to do a total knee replacement. However, if 2 or 3 compartments are affected, then of course you need to do a knee replacement. That was to answer the first part of the question. The second part was, how long does it take to recover? Well, usually hospitalization is 2 to 3 days, and it takes around 6 weeks to pretty much become normal.
And
is slow jogging permitted? I think so, yes. After a knee replacement, as long as you're not doing high impact jogging, basic slow, fast walking or slow jogging is permitted, yes.
Right. We have 2 questions from Suresh Kamath, who asks, after surgery, can you sit down on the floor and can you do yogasanas like Vajrasana?
Okay, so Mr. Kamath, the implant has a limited life, and if you misuse the implant, then you are to some extent going to affect the life or the longevity of the implant. So sitting cross-legged on the floor or sitting with your legs stretched out on the floor is perfectly all right, because that doesn't put a lot of load on the implant. However, if you sit squatting style or like in Vajrasana or on an Indian toilet, here you are putting more load on the implant. So while it is possible, and even many doctors allow their patients to sit that way, you need to remember that if you do that regularly, you are to some extent going to affect the life of your implant. So then it's about, you need to choose. Would you rather avoid that and have your implant last longer, or would you rather do that and face the consequences in future?
Doctor, we have a question from Mrs. Saras Gupta, who's age 62. And she says, I have been told to go for a knee replacement, but I'm a little confused. Would like to know, should I go for both knees replacements simultaneously, or one knee replacement initially and second after a few months? Please advise with reasons if you can. I'm not diabetic and BP remains at 70, 110. Movement is now restricted to the home.
Okay. So if both your knees are equally bad and both are hurting you enough to have the surgery, then it is better to do both together, because the physiological trauma to the patient is not double when you do both. And you don't need to go through the whole cycle of getting admitted, going through the surgery, going through the physiotherapy twice. You finish it off in one go. So when should you do only one at a time and not do both together? if you have significant cardiac risk, because in that case, you shouldn't do both together, because doing both knees together puts the body at a little more risk. And if you already have a lot of comorbidities, it's not advisable. The other time you shouldn't do both is if your second knee is not really badly affected. Then why do the second one? Then you might as well wait for it to get bad. It could be after 5, 6, 7 years, and then do the second one.
Thank you. We have a question from uh, Maya Mukhi, who asks, what are the three compartments? I was in an accident some 7 years ago and injured my knee with a depression fracture. After surgery, I still have pain, which makes me feel that the surgery was a failure. What would you suggest? Would a knee surgery be recommended?
Uh, Now, the three compartments in the knee are basically the medial compartment, which is on the inner side, the lateral compartment, which is in the outer side, and the patellofemoral compartment, which is in the front under the kneecap. When you had a fracture, one of those compartments was damaged, and the cartilage on the over the in that compartment probably got damaged. Now, sometimes, unfortunately, even with the best surgery, if the cartilage is irreparably damaged, you can be left with persistent pain. So, should you have this a surgery? That depends on the degree of pain you have. If your pain is not so bad, it's manageable, and you are relatively young, then my advice would be to carry on. If you are older, you have significant functional disability, then certainly you are a good candidate for some form of knee replacement.
Right. Thank you. We have a question from Malti GK, who says, Doctor, my mother is suffering from knee pain and from 1 year planning to go for a knee replacement, and her age is 68 years old. She is she has Parkinson. Will it be fine to do a knee replacement?
Uh, if the Parkinson's is well controlled, it is all right to do a knee replacement. If the Parkinson's is very advanced, then the problem with doing a knee replacement is that your physiotherapy and your recovery becomes very difficult. And the patient with a severe Parkinson's sometimes does not recover from a knee replacement as successfully as one would hope. So you need to see how badly the Parkinson's is affecting her and how much her pain is, and weigh the two and take a decision based on these two factors.
Uh, there's a question from KD Dadanchi, who says, Doctor, we were given to understand that a knee implant would last 10 years or so, and then you need to redo the surgery mainly in senior citizens. Is that always the case?
Uh, I think 10 years would be an underestimate. With today's implants, I would tend to put the figure at around 20 years. But like I told you, it also depends how you use it. The more active you are in terms of high impact activity, the earlier it will. If you are a basic senior citizen who goes for walks, does activities like leisure tennis, the implant is going to last you 20, 25 years. So don't worry about that.
Thanks. We have a question from Venkat Sundaram. Uh, he says, I'm an ex-cricketer and now a golfer. I walk 10K steps, 10,000 steps, and gym and swim. My knees were hurt decades ago. I'm 71 but physically fit. My BMI is 23. Do you suggest I can carry on?
Well, if you're playing golf, you're walking, you're swimming without much discomfort, I don't think you need to really do a knee replacement. I think what I would advise, I don't know, I've not seen your x-rays, I've not seen you, but what I would say, if it's really paining you and you're finding it difficult to do these activities, then by all means have a surgery. But if you're doing these activities without much problem, then I would advise you to wait.
Uh, Coming to questions that are there, and we have so many questions that have come in. We have a question from Ashok Grover. Let us look at an exercise kind of thing. Is walking backwards a good exercise for strengthening the muscles of the leg, and does it make the knees strong?
Uh, so the muscles around the knee are essentially the quadriceps and the hamstrings. Most exercises people do strengthen the quadriceps. Walking is one walking backwards is one exercise which stimulates the hamstrings. So yes, it's a very good exercise. Only thing is you should make sure you don't fall, because walking backwards you're very likely to fall. So just don't fall.
Thank you. We have a question from Shiv Shankar Joshi, who says, I'm 62 and diabetic. The diabetes under control because of medication, highly controlled diet and exercises, mainly walking. What are the potential knee issues that can come up? What are the things I need to do to prevent any complications to the knee?
So if your diabetes is well controlled, if you're not overweight, if there is no family history of arthritis or similar such problems, it's very unlikely that you will develop knee issues unless there's some predisposing factor. So I would say don't worry about it. Just continue. You seem to be having a healthy lifestyle. Your diabetes is well controlled. Just continue what you're doing currently.
Thank you. We have a question from an anonymous attendee who says, I'm 60 years old, having a BMI of 33.25, diabetic, having cardiac issues, uh, varicose veins problem, had done an X-ray in 2011, October, of the right knee, which showed advanced stage osteoarthritis. And after that, not done an X-ray, but right knee shows swelling and have problems getting up, standing, etc. Please suggest some remedial measures.
So your BMI is definitely a little high. Now, I know it's a catch 22. Because of your knees, you can't exercise, but you really, if you want to get away without surgery, you really need to lose weight. That's going to be the one most important thing which will help you reduce the pain in your knees. The other things you can do are free exercises which will not hurt you. So, exercises sitting on the edge of a chair or sitting on the edge of a bed or lying down without the body weight going through the knees. These sort of exercises will strengthen the knees. At the same time, they will not be painful for you.
We have a question from Varsha Gulab, uh, who says, I have a torn meniscus. I don't have too much pain. Should I have a keyhole surgery to repair the meniscus? I'm 70 years old.
Uh, if you are 70 and your meniscus is torn, now I can't really, without seeing you or seeing your MRI, advise you. But I can, if I had to hazard a guess, I would say no, don't have the surgery. At 70, the chances are this is going to be a degenerative tear. It is not a sports tear. Degenerative tears don't do well after a keyhole surgery. It's the younger people who have a sporting meniscal injury who really are candidates for this sort of surgery.
Uh, Doctor, this is a very detailed question. He says, I'm Narendra Dharmashi of 66 age with weight is 115 and height is 5 feet 10. I'm living a sedentary lifestyle in Mumbai. I'm a heart patient with angioplasty done in 2002 and 2014. I take medicines. I have osteoarthritis and pain in the right knee sometimes. I'm taking tablet Neurobion and tablet Jointis OD, amongst others. Please guide me for future precautions to avoid knee pain.
Again, sir, I think you need to lose a little bit of weight. That's the most important factor. And also, please keep doing some uh, exercises, increase your activity level if you're too sedentary. I think that would be about it.
We have a question from Rakesh Chawla. Of course, I've done the introduction, but says I'm 69 years old and need to get a knee replacement surgery in the right knee. I stay in Kandivali East in Bombay. Which hospitals do you do your surgery at in Mumbai?
So the hospitals I go to are Breach Candy, Jaslok, Sandas, and Saifee. So I'm only in South Bombay.
Okay, we have a question from uh, an anonymous attendee. Would you recommend specific yoga poses to eliminate and alleviate uh, knee pain? And we have a question from Pradeep Bhai Shah, who says, I have a very bad pain in my right knee. Can you suggest some exercises that will help reduce the pain? So uh, we've had a question on walking backwards, and these are two for.
So to answer Mr. Pradeep's question, the first thing you should see is why you have the pain in the knee. Presumably, if it's osteoarthritis, you should do exercises. Again, I'm just repeating, but it's good. These exercises, whether they are yoga or you do them in a gym or you do them with a trainer, it doesn't matter much. Essentially, they should be non-impact, flexibility, and knee strengthening exercises.
We have a question from Parag H, who says, my grandmother is 74 years old. She walks very slowly. Legs are swollen. Can this be cured by wearing stockings or is a surgery needed? She is a diabetic patient.
So, uh, I think what you need to first see is why is she walking in slowly. It doesn't have to be because of osteoarthritis knees. The indication to do a surgery is pain. It is not for, you're not doing it for swelling in the legs or that you're walking slowly. So you, you need to get a proper diagnosis first. Certainly, the swelling in the feet is not going to improve after your knee replacement. The swelling has some other cause and you need to look at it. Yes, once you diagnose it, it is very likely that if you wear stockings, it will help. But first, get it diagnosed.
Right. We have a question from Ashwin Mehta, who says, I'm 73 years old. I have a slight pain on both my joints since the last few months. It is early days, and he needs some help on how to uh, help ease his pains.
Okay, so in the early stages of osteoarthritis, certainly you don't need to go in for surgery. What you should do is again non impact exercises, remain active, avoid activities which uh, like jogging or squats or too much stair climbing because these are likely to aggravate your pain. What you could do when you go for a walk is wear some form of support on the knee, like a kneecap. That might help you. And just carry on for now. It doesn't sound like you need a replacement or surgery yet.
We have a question from Kuldeep Grover, who says, I'm a retired brigadier, 67 years old, a fitness freak who had to undergo uh, TKR for both the knees 14 months back. Though I can walk well and do cycling, etc., unfortunately, my knees continue to pain somewhat. He says he has shown his x-ray to the doctor and they say everything is normal. Is this normal post-operation, he asks. There are others who say they have no pain whatsoever. All medical parameters are totally normal with me. Uh, could you advise what I should do?
Uh, Sir, difficult for me to tell you. There is a small percentage of people who, after a knee replacement, continue to have pain. But that's a very, very small percentage. And usually these people have a very low level of pain. So I don't know if you fall into this category. But by and large, after a knee replacement, one should expect to be pretty pain-free, and without seeing your x-rays, or I'm really not able to advise you further. I'm sorry.
We have a question which is a similar question has been asked, but I'll still ask this. This is from an anonymous attendee who says, I'm 75 years old, diabetic patient, varicose veins, swelling in legs, heavy knee pain, and difficulty in walking. Should we go for a surgery, or are there any other suggestions?
Again, it depends on the degree of pain. So your swelling in the legs is probably from your varicose veins. That's not going to improve after your surgery. What you need to look at is the degree of pain you have in the knee. If your pain is significant, yes, have the surgery. If your pain is manageable, wait a little longer.
We have a question from Ashok Grover who asks, does contrast fermentation help knee pain?
Yes, it does help you, but of course, that is a temporary benefit. It's certainly not solving anything. You will feel better for maybe 15 or minutes to half an hour.
We have a question from Narendra Acharya who says, I'm 64. I got high risk osteoporosis in the spinal cord and joints. What precaution is needed and what exercise is advisable?
So, osteoporosis is a totally different issue to knee replacement, of which is because of osteoarthritis. Osteoporosis essentially means your bones are weak. Now, for that, what you need to do is make sure you're taking adequate calcium, make sure you're taking adequate vitamin D. You must remain active, you must walk, you should do little exercises with weights because these weights strengthen your bones. And if you've got a high degree of osteoporosis, then you need to go on to, there are higher medications which your doctor will advise you. You need to consider one of these medications.
We have a question from Shubhangi Gaikwad who says, our doctor has suggested knee replacement for my husband 3 months back. He usually gets pain during the winters. What are the odds that we wait for replacement for 3 or 5 more months?
If you only get pain in winters and the rest of the year you have absolutely no pain, I think, frankly, I think you should wait rather than jumping into a knee replacement. But the deciding factor, remember, the deciding factor is the degree of pain and the degree of functional disability you are having. When do you do a knee replacement? When your pain is significant and the functional disability is significant.
Typically, in the case of knee replacements, is it a near 100% success rate, or is there, is there some kind of a percentage you could put?
So, what are the problems of nothing in life is 100%, but what are the problems? There are a few issues which can perhaps which can persist after knee replacement. The first we've already spoken about. There is a small group of people who continue to have a little pain after a knee replacement. We've not quite, the medical, when I say we, I mean the medical fraternity, we've not quite understood why this happens. It's related to the pain fibers in the knee, and that's why some people continue to have pain. The other problem which you can have, and which can be a big issue, is if you develop an infection in the implant. Then that is a significant problem. So these are the two main issues. Then there are other side effects, like after a surgery, you can have medical issues or a clot in the uh, veins of the leg. These sort of issues happen with most surgeries, and they are at a very, very small risk. So overall, I would say a knee replacement is among the most successful orthopedic surgeries.
We have a question from Rajiv Virmani, who says he's age 65, BP and diabetes under control, overweight, having pain in the left knee while bending, not able to drive the car because he gets heavy pain while pressing the clutch. Walking is no problem. Can you suggest things that he can do?
Okay, so again, I think you need to see a doctor, see why the pain is there. Probably it is from early osteoarthritis. The part of the knee which is affected is probably the posterior part of the knee, and that's why when your knee is bent, you're getting the pain. You're loading the knee when your knee is bent. And for that, what you need to do is basically go to a physiotherapist. Some exercises should definitely help you. They won't cure your problem, but it will definitely help you pull on a little longer.
Right. We have a question from Usha Bhatia. Says, Doctor, to avoid such knee problems, do you suggest a regular oil massage on the knees along with exercises?
Exercises, yes. Oil massage, I don't mind if you do. Will it prevent knee osteoarthritis? I don't think so. Personally, that's my personal opinion, but it can't do you any harm. So, by all means, if you enjoy it, do it.
Maya Mukhi asks, what are some non-impact exercises?
So, basically, when I say non impact, I mean you should not be loading the knee with your body weight, or so no jumps, uh, or jogging, those sort of exercises. So you can have a simple exercise like cycling on a recumbent cycle, or you can sit on the edge of your bed and do quadriceps curls, or you can do lying down and cycling in the air. These are sort of simple exercises which are non impact.
Pradeep Bhai Shah asks, do glucosamine tablets help in knee pain relief?
Uh, Now, there are a lot of nutritional supplements which are supposed to help knee pain. Glucosamine is just one of these multiple nutritional supplements. There is some evidence to show that these nutritional supplements give benefit. Is there any conclusive evidence? No. So I cannot tell you with certainty that glucosamine will help you. Certainly, it will have a transient effect, it will not have a permanent effect. And what I would suggest you do is try these nutritional supplements. If it seems to be benefiting you, take them because they're harmless. But if it doesn't help, then drop them, because there's no big medical study which says they definitely help.
Thank you. We have a question from Mr. Mittal who says, I'm 75-year-old man, height 5 feet 7 inches, weight 75 kgs. I have no pain in the knees. Movement is cautious. If movement is fast, the knees tend to buckle, so I slow down. I have a difficulty in climbing stairs. I use a walking stick for additional support when required. Also, I have a difficulty in sitting down and getting down.
So you don't really have any pain, but what you are describing seems to be a lot of weakness in your quadriceps. So I'm pretty sure that if you could consult a physiotherapist, ask them to teach you balancing exercises and knee strengthening exercises, you will definitely benefit from these.
Uh, Speaking of knee strengthening, Suresh Kamath asks, by strengthening the leg muscles around the knee, can you avoid surgery or delay the surgery?
You can definitely delay the surgery. It's unlikely you will be able to avoid the surgery, because the muscles, by strengthening the muscles, what you're essentially doing is you're not reversing the osteoarthritis, you're just giving better support to a damaged knee. So you can definitely delay the surgery.
Right. We have a question from someone who's not 60 plus, but it's an important question, interesting question. He says, "Sir, I'm 50 years old. Knee pain has started while giving a kick to the bike. Sounds come from the knees. Please recommend what I should do to avoid further damage."
Uh, so I think the first thing you should do is just do an X-ray to see why the sounds are coming. Remember, that a sound which has no pain is not necessarily something serious or dangerous. It's only if the sound is accompanied by pain that the sound is significant. A lot of people get sounds from the knee, which is can be absolutely innocuous or harmless. Again, what you could do essentially is uh, strengthen the knees. If you're overweight, lose a little bit of weight, and you should be good.
There is one, Mr. Shankar Chavan is 81, who says having pain in the left leg in the knee. Is it advisable to go for a knee replacement at this age? He's 81. I'm not suffering from anything other than knee pain, hernia, and prostate problem.
So 81 today is not considered that old. You need to look at the full picture. How much is your pain and how much is your activity level? If your pain is significant, then yes, do it, because by doing it, you can maintain a high level of activity, you can remain active, and you can enjoy a better lifestyle.
The last question we'll ask is, it's a slightly unfair question to ask you, but Malti GK asks, could you let me know which is a good hospital to get the operation done? But this is just a general guideline for people.
So, yeah, so as a general rule, uh, now knee replacement has become a fairly common surgery, and it's done, I think, in most hospitals. When you're looking at where you want to do it, the first thing you should decide is choose your doctor. Find a doctor in whom you have faith, and then let the doctor guide you towards the hospital. By and large, you should go to a hospital which has a good operation theater setup. And if you have comorbidities, try and go to a hospital where there's an ICU, so that in case there's a medical issue, then, and if that hospital doesn't have an ICU, there should be adequate support in the hospital.
So not a small nursing home.
Yeah, by and large, my advice would be avoid it in small nursing homes. I know by doing it in small nursing homes, you keep the cost down, which is a significant factor for many people. But I would still say a bigger hospital is a better bet.
Doctor, in the last 40 minutes, we've asked you responded to some 35 odd questions. So thank you very much for having come over once again and very painstakingly and very patiently answered all the questions of our readers here. Thank you very much once again, Dr. Soonawalla, for your time and for responding to all questions.
Not at all, Pradhaman. It's always a pleasure to be here.
Thank you very much.
Thank you.